this coming Tuesday, for all municipal buildings, there will be a mask mandate. A mask mandate for employees, a mask mandate for people getting services from the city. Certainly we are cognitive of space requirements and trying to provide some flexibility, but our overall goal is the health of our employees and the health of our citizens. And the statistics clearly say we need to do a better job in terms of masking and in terms of vaccination. So we are putting that into effect starting September 7th. Right now, we are putting it in effect until October 1st. We will review it September 28th to see what the new statistics indicate. I would love to have the new statistics indicate that we are going in the right direction and that as of October 1st we can maybe alleviate some of these mandates. But that's going to take cooperation from everyone, our employees and our citizens. So that's number one. Second, while I will not mandate and I cannot mandate all of our businesses to have their employees masked and have their customers masked, I want to encourage all of our businesses to, if not mandate, strongly encourage to the greatest extent possible all of their employees to wear masks. I do that for two reasons. Just in personal experience, when employees are masked, customers tend to mask as well. When employees are not masked, customers tend to be less fruitful in terms of masking. From an economic standpoint, it makes sense for those businesses because the more people that we have unfortunately affected by this pandemic, the worse it is for our economy, the worse it is for their business, the worse it is for their employees. They and we all need to be on the same page. We all need to understand that we have a responsibility not only to ourselves, but to everyone else. We are not immune from impacting someone else. We know the statistics clearly indicate that we have a responsibility to each other to keep each other as healthy as possible. And I am encouraging all of our businesses and all of our citizens to take care of each other and recognize wearing a mask, yes, maybe it deprives you some of your freedom, but ultimately it's going to give us the freedom to be the kind of community we want to be that helps each other and gets healthier. The last thing I want to indicate, statistics, and I've got John Gonsalves, Director of the Board of Health, and Debbie Shire, our nurse from the Board of Health, that will share some statistics. But the reality is our vaccination rates in Holyoke and in Hampden County, for that matter, are nowhere near what they should be. I am encouraging every employee of the city of Holyoke to understand the statistics. Look at what the statistics say in terms of vaccinations and the pandemic. Look at what they say when a person who's been vaccinated gets sick in terms of the degree of their illness. Every common sense statistic says get vaccinated. I want to encourage, look at the statistics, common sense, let's work together, let's fight this thing, and let's win. And lastly, at some point, and I'll deal with this from a labor standpoint, at some point, the cost of health insurance is going to prevent us from providing raises and or give us lack of money to hire new people. I mean, from an economic standpoint, if you want a long-term employment future and you want to be successful, we need to reduce our cost of health care, not raise it. And the more we send people to the hospital, the more we do not deal with this. That's a cost to the city, that's a cost to the county, that's a cost to the state, cost to the country. We need to deal with it on all of those aspects. But ultimately, the number one aspect is let's care about each other. Let's let ourselves get healthy. Let's work together. I'll accept questions, but I do want to let both Sean and Debbie answer any questions regarding healthcare statistics, and that's why they're here. Sean?
Thanks, everyone. As Terry mentioned, I'm Sean Gonsalves. I'm the director of the Holyoke Board of Health. Just to start, as a premise, we monitor these case counts on a weekly basis. We look at increases in testing. We look at positivity rate. We also look at some of the context of the information that we're given. So working with Debbie, with the schools, with the hospitals, we see the capacity that the hospitals are at. We monitor breakthrough cases. And so we've had 9 consecutive weeks of case count increases. That is to say, each following week there have been more cases than the previous week, beginning the week of June 30th. June 30th we had 1 case that week. The last week we had 90 cases. That's the week of 8/25 when the data was published. So you can see the incremental rise in cases. Week over week we start to see an increase in cases among children, and that's really troubling to us as well. Earlier in the pandemic, the thought process was that children had lower susceptibility, or they were less likely to be affected by COVID, and that they had a little bit of a natural resiliency. We're seeing more and more that school-age children are being affected. In the last few days, yesterday we had 20 cases, 9 of them were school-age children. So that proportion is not constant. It's not every day that 50% of our cases are children, but it's a growing trend in Holyoke that more children are being affected by this. And children are dependent on their parents, and so if a child is affected, they're going to bring that home. Parents are going to interact with them. They're not able to maintain distance as you might from another adult, and that increases the likelihood of spread in the community. So it's one aspect that we're really grappling with that we didn't have to deal with so much last year when schools were closed and when there wasn't the same amount of businesses and enterprises being open. So vaccination rates in Holyoke are at about 51%. That's fully vaccinated. Statewide, it's 64%. That's as of the last reporting period from last week. The data is not going to come out until later today for this reporting period. Between August 18th and August 31st, we had 4,619 tests in the city of Holyoke, and that's an increase of 450 from the previous reporting period. So that alone showing community concern. More people are being tested, which means more people either feel that they've been affected or feel that they need to monitor themselves. And that's an easier way to gauge some of the impact that it's having in Holyoke. We had 167 cases in that same period of August 18th to August 31st, and that's 48 more than the previous reporting period. So you can see the growth in all ways. A majority of counties in Massachusetts are considered high risk per the CDC, and so we feel that due to this sustained increase that this is another incremental step in trying to reduce the spread of COVID in the community. We have masks in the schools, we have masks in municipal buildings, and we're going to continue to monitor the circumstances in the city and case counts, and the board and myself and Debbie will meet to see if additional mask restrictions are required. Debbie?
Hi, good morning. So my name is Debbie. I'm from the Holyoke Board of Health and the public health nurse. Just to let you know basically how our monitoring of these students takes place. In the morning when I get up, first thing, even before I leave my home, I look at all my cases. From there I go through to see who's the children they are, whether they attend Holyoke Public Schools, they could attend charter school, they could attend another school in a different district. I'm in constant communication with the school nurse supervisor just to alert her, and then from there it trickles down to the school nurses to make sure that student or any siblings are not in school. We try to get a handle on that right away. So as of a few minutes ago, when I just spoke with the school nurse supervisor, I'm just giving you an update. Since August 23rd to 9/2, actually, let's say it's 9/3, there have been 42 cases in the past 10 days. Elementary students, pre-K to K, there's been 27 cases. High school students, grades 9 through 10, are 10 cases, and the staff are 5 cases. Now, this is a reminder, there have been no transmission of the COVID virus in school right now that we're aware of. Okay, so today, all these cases have occurred within the community. So as of right now, there is no in-school transmission. And other than that, we continue to guide the school department, whether it's a seating plan, whether it's masking. Frequently, I go with one of the inspectors and we go through the schools and just keep an eye out. And we give a gentle reminder if we see people with masks down. But we're always in communication and we're always there to assist them. Thank you.
So obviously, we're here to take any questions we have, but I want to thank Sean and Deb for, we've been meeting, when I first started as acting mayor, Sean and I were meeting regularly, then I guess he didn't like seeing me, so we stopped seeing each other because the health situation seemed to get better, but obviously, we're now meeting very frequently again, and I appreciate the statistics that they provide, because obviously they give us an alert that we've got to take some action. I also want to emphasize that anybody that wants to be vaccinated, they can contact the Board of Health and they'll find them a slot. If they can't get the Board of Health, they'll call my office. That would be fine. We'll get them an opportunity to get vaccinated. But we need to work together, and it's a life-saving situation. It's an economic situation. It's a vitality situation. We just have to deal with it. So we'll take any questions that you might have.
Can you remind me demographics?
Sean.
Age group, section?
So in Holyoke, I will say the areas where we have our lowest vaccination rates are the 20 to 29 group and then the 12 to 19 group. So that's really where we're seeing the lowest rates. And that's not just representative of Holyoke. That's actually pretty typical throughout many communities in Massachusetts. There's been the least amount of availability to the 12 to 19 age group for vaccinations, so they sort of had a slower start anyway. But then we still do see some parents who have concerns. Maybe they're not ready to have their children vaccinated yet, and so we have vaccination clinics in the schools to try to make it as readily available in a comfortable setting as possible, but we still don't see the vaccine response and urgency that we have seen in some of the higher age groups. So in our 65 and older groups and in our 30 and older groups, we're getting closer and closer to the state average every day. In the younger age groups, that's slowing. Among the Hispanic and Latino population as well, those vaccination rates are a little bit lower. So we have constant vaccine outreach. We have vaccine clinics that are happening every week. We have one at the Holyoke Mall this weekend. We try to make it as available as possible. We try to make it in environments that are perhaps not as intimidating to people outside of like a medical setting or outside of the clinical setting, which some people are very uncomfortable in, but it is the younger crowd that we're struggling with.
What kind of calls are you getting from people or emails? Are you still battling that misinformation? Because we've been talking about that for some time.
We don't directly see too much of the misinformation, but even when the schools moved to announce that they were going to have masking in school, we got a couple of complaints from people who feel that they should be able to make the decision for their child, or that they don't like the idea of the schools or the government setting the tone. And people are welcome to their opinion, and we try to respond, not necessarily in a combative sense, but just look from our perspective. We're trying to protect the group. Children, certain people don't have the agency or the ability to not be in those environments like an adult would. You don't have to go into a restaurant if you don't want to. You don't have to go into certain businesses, but children have to be in school. Certain people have to be in facilities, and so requiring these masks, for instance, is a way to protect people that don't have the ability to make a choice, where some people may.
So the Pfizer vaccine is FDA approved right now.
It is.
How do you convince this age group to get vaccinated?
I don't know that there's an answer there. I'll say that. If you listen, if you look, you'll see, we advertise in the mall at the digital kiosk. We have video that runs there. We have information that runs there. We advertise on the side of PVTA buses. You hear it on the radio. We have festivals. We have events that happen in Holyoke. There was just one on the 28th with music and food. We had a vaccine clinic there. I think being available to take questions, to talk to people in a way that's not high stakes, they can come to you, they can seek out that information. That's the way you kind of erode some of those barriers. You don't necessarily need to be like, it doesn't need to be a conversation that makes people uncomfortable. You want to allow people to maybe slowly break down the walls to resistance, and then over time, the hope is that more and more will get vaccinated. And we're still trending in the right direction. Massachusetts has some of the highest vaccination rates in the country, and even 51%, which, you know, to Terry's point, is low for Massachusetts. It's much higher than many other communities in the country. So it is still a positive sign. It's just something that we want to continue to work on.
I have a few questions on the school front. First, Devin, you said that the transmission is not happening in the school, it's happening outside the community. So where are these cases coming from? Is it like after school gatherings, is it sports, or where is it not coming from the schools?
If I had to guess, I would say it could have been families that decided maybe to take a vacation before school started. That's just a guess right now. I ran up some more numbers before I left. Age 18 and younger, since July 1st to today, it's been 125 confirmed cases for children. Whether people decide to go visit somebody, and when we're talking about children that are 1 and 2 and 3 years old, we know these children aren't just going out on their own. They're going out with families somewhere. So whatever families are engaging in, whether it's another family member that tested positive, or maybe they took them on a vacation somewhere. Obviously, they're getting it from someplace. And I'm very much concerned about the amount of children, the increase in children. And holidays, like I said, we're coming up. We've got Labor Day, we've got Columbus Day. Football season's coming. People are going to be inside. There's going to be more gathering inside as opposed to outside. So it's just an element of concern thrown in here again.
And the home has been, throughout COVID, the number one area for transmission. People don't tend to mask in their home, people tend to be in closer quarters in their home, and so that's been a contributing factor of
I have another question too, just to follow up on this.
Yeah.
Okay.
So from what I checked on Wednesday, the cases stood at 20, so now it's 42, so that's a 14 case jump in just 2 days. So what's the concern, especially as Jesse's saying no remote learning this year?
Well, two things. And again, right now it looks like a lot of what is happening is not necessarily happening in the school. So let me start with that. So that right now, as I understand from the superintendent, students and all staff are really sticking to the mask mandate. I will say, and I know Deb has brought this up to me a few times, we got to make sure that it's over everything and not just more comfortable, if you will. So that's one thing. And so far, it hasn't been school cases spreading as much as community cases that then affect some of the kids in school. So that'd be one thing I want to emphasize. So education, and we've got to be able to educate our kids, because Holyoke already has a history in the last few years of being behind academically. We've got to catch up. And we got the health of the kids that we have to concern ourselves with. We also got the future of the kids that we got to concern ourselves with. So we got to make sure it's as safe in the schools as possible, which I think we're doing. But it would be safer if more 12-year-olds to 18-year-olds were able to get vaccinated, if we had less spread throughout the community. So again, it's a community effort. And trying to get people who are not in those levels of high vaccinations, I try to reach out to their heart. They all know some kid that's 2 or 3 years old. Do you want to be someone that because you have this feeling that you want to have, that you don't feel comfortable, that you get the pandemic and then you end up spreading it to someone that you love? I mean, think of it that way. I want people not to think of we're trying to mandate something. We're trying to help make the community safer. And everybody loves someone. So it may be your grandparent, it may be your young niece. Let's make sure that we do what we can to keep them healthy. I don't think there's anything more crucial than expanding that vaccination rate.
Right. And at this time, do you know, if these kids are missing school, how do they make that up? How does that count? Is it extended through? Do you know that at this time, or is it still too early on?
In terms of academics?
Yes.
Yeah. Right now, it's my understanding, they're trying to make sure they have extra tutoring, but it's still not the same. If you're out of school for 2 weeks, it's very difficult for that kid to be able to catch up and come back and be comfortable catching up.
If I could,
yeah.
So, the schools have the test and stay policy in place, so they're able to use Binax Now tests. And so if you're a close contact in the school to a school-based exposure to a positive student or a staff, you're able to get tested on a daily basis. And so last school year, if you were a close contact, you would have to go home, and then you would miss 7 to 8 to 10 to 14 days, depending on the circumstances. In this case, the state has created an opportunity for the school to continuously test these children with parental consent, and that opportunity means that if you're exposed, they'll test you every day. If you're negative every day, you remain in school. So fewer children are missing fewer days, and that's one way to sort of mitigate some of the loss of school time that we had last year.
Sean, what's the last time that you take that? Is it still a little bit more real time? I remember who's typically taking last time.
It's weekly. Yeah, I mean, it's so we get a lot of our data, we get case data every day. So that, I'll say, that comes from Massachusetts Virtual Epidemiological Network. It's called MAVEN. Those cases come down every day. We can talk to an epi every day. But some of the more macro statistics about testing or about community-wide case counts, because we can add them up day by day, but the numbers in a nutshell, they come out weekly, and when they come out weekly, they're usually 3 days behind. So information that's going to come out today will be tabulated by the state midweek, and then it'll be released Friday afternoon or Thursday afternoon.
And then how are you preparing for any assistance from city employees who don't want to work now or why? What are the consequences?
Yes, there'll be consequences. We need to work together, and this is for their own good and the good of their fellow employees and the good of the community. We have to accept that responsibility. It is a health issue. It is a safety issue. And obviously, when they're in their own office and their space, the mask mandate is not there. But when they are within close contact, when they are serving the community, the mask mandate is to be mandated. And supervisors are to know if there's an employee that is not living up to that, the personnel office and my office need to know, and the Board of Health office needs to know, and they have to be dealt with. I mean, there'll be some consequences. I mean, you have to be in a position to enforce it. Otherwise, there is no mandate, and we will enforce it.
Is there any plans to mandate it for all employees around the city?
One more time.
Is there any plans to mandate the mask order for all indoor places in the city?
Well, we've talked a little bit about that. I think we'll watch the statistics. This is where I know I can mandate it, and the Board of Health is meeting again in a couple of weeks to consider more mandates. But as of right now, it's an advisory out in the other areas, but I would strongly encourage them to mandate their employees because I think that improves their business and improves the health of the community.
In terms of hospitalizations, do you track people who are vaccinated versus unvaccinated?
I'm in constant communication with Holyoke Medical Center, which is our city-run hospital here, or Bay State if they had to call me about a Holyoke resident. And what happens is the infection control nurse will call me daily, whether she has an employee. These are Holyoke residents now. Whether she has an employee or she has somebody from our community who is hospitalized, and we're in constant communication with that. So she's letting me know when a person is admitted, they tested positive. She's also let me know when they're discharged and where they've gone. So it's an open line of communication.
So do you have statistics of who's vaccinated versus unvaccinated?
She will let me know. She will say, whatever, Jane Doe is admitted and, you know, she's vaccinated or she's not vaccinated or I don't know. From there, I am able to access that information about vaccination on the MIIS, mass immunization system through the state if she needs it. So we're in
So what
communication.
is that ratio about?
I'd say it's less than 50% of people that are hospitalized that are vaccinated at this point.
The national average for breakthrough cases for the vaccinated is 25% or less as well.
Yeah.
And not only Holyoke Medical Center, but Bay State. I know Dr. Kirorak, I think is the pronunciation of his name. I mean, we're getting to the point where they're having, you know, I think it was, they had 2 patients about 2 months ago, and now they're over 100. And they're starting to get to the point where are we going to be able to put people? Where are we going to get the medical staff to be able to help those people? And as I understood it, even more than 75% of those were unvaccinated. So clearly, vaccinations make a difference. Please, please get vaccinated. Thank you very much. Appreciate it. Let's make sure we make this a better world. Thanks, Sean. Thanks, Deb. Great job. You did a good job. You're probably going to want press conferences all day now, huh?